Dan Williams, Survive Outdoors Wilderness Medicine. This is part 2. The first video I did, I will put in the discussion below as well as at the end on what medication, and has something on bandages of what you should stockpile in your home in the case of a severe emergency crisis, the grid goes down. So I really advise you to watch that one. That one's a lot longer than this one's going to be. But I forgot some things. And a couple of the areas we're going to address today, I'm going to go back and address the ibuprofen gel versus tablet. I'm also going to discuss with you guys one of the most important genders, if not the most important gender, is the female gender. We didn't talk about some of those needs, and they have specific needs that need to be addressed in case of a crisis. Also, I'm going to talk about barter and trade in case of a crisis emergency in terms of meds and some of the items that we're going to talk about today. So the ibuprofen gel versus tablet. If you Google goodrx.com and a couple others, you'll see where they quickly state the gel is absorbed much quicker. No, it's not. And if you look at the study here, and I'll read some of it, it says they did 18 eligible studies, tablet versus the gel. There was no significant difference in the median time of first perceptible pain relief. And I've only found one study that showed that the gel is absorbed only 4 minutes quicker than the tablet in the GI system. So, so there is that. And I had a couple colleagues of mine that discussed this with me when they saw the first video. And so I thought that article I put up would help clarify some of that. I like the gels. Why? Probably a psych thing, because there is no physiological basis to do a gel over a tablet. So let's talk about women's health. You need to have on hand, you're going to have those antibiotics I talked about, because it's very common, women are more prone to urinary tract infections than men. So you need to have some of those antibiotics. Almost all those antibiotics that come in Duration Health that I discussed in the last video, you're going to have quantities of 20, it's usually twice a day, 10 days, 20 tablets. Vast majority of urinary tract infections you're going to knock out in 3 to 5 days. So it's really remember that, because it's really kind of nice, because one bottle, you can probably use that twice for something else. So that's important too. Most infections, not all, but most, you can get away with 5 to 7 days, all right? And this is in an emergency situation, all right? I'm not talking every day. You go to your doc, you go to your provider, you have a sore throat, you have strep throat. God, there's been a ton of that lately. A pneumonia. You always finish the script. Always finish the script. Please, okay? This isn't a survival situation. Much different. Much different. So remember that, all right? So in women's health, you got the antibiotic on hand. You need to have cranberry pills, cranberry juice. I advise pills in that situation. The juice is going to expire quicker. So cranberry pills, basically, it's going to lower the pH. It's going to help a lot in terms of avoiding UTIs and help if they do have a UTI. Over-the-counter meds like AZO, they do help, and it's combined with cranberry pills, but I'm here to tell you it makes my life miserable, because when they give a urine sample, it's jacked up, and some of the readings, it's just not going to be accurate. So have some cranberry pills on hand. That's important. And then you need to think about your wives, your daughters, your girlfriends, dysmenorrhea. So what is that? Dysmenorrhea is painful menses, cramps. And one of the best ways to knock that down, where it's at least tolerable, is an anti-inflammatory. And one of the best ones out there is naproxen, Aleve. Aleve is 220 milligrams. You can actually do naproxen. It comes in 500s. So I usually combine naproxen with Tylenol, and that usually helps a lot with the dysmenorrhea, as opposed to ibuprofen gels or ibuprofen tablets. Thick pads and tampons. Dual uses on these things. You'll see survivalists talk about get the thickest maxi pad you can get, like this one over here, And you can use that as a bandage. You can cover up your belly wound and you're going to get shot with an AK-47. All right, so look, guys, we need to, somewhere between the extreme reaction over here and the extreme reaction over here is really gray. Yes, it's nice to prepare, but common sense, all right? So, yes, they do work well as bandages. Get you some thick pads. They can be used for a lot of different things. Tampons. Really, really helpful. I've even seen individuals in the outdoors use a tampon for nasal packing. So I've actually seen that being done also. So important for it to be stocked up, tampons, maxi pads, something for urinary tract infections. That's really important also. Barter and trade. You're going to see a lot of individuals on YouTube, on TikTok, which, by the way, we have a presence there, but there are no videos. You'll never see Survive Outdoors clips on TikTok. Just my preference. Maybe someday I'll get into that. All right, so you'll see on TikTok, YouTube, Instagram, where these survivalists are talking about barter, and they're talking about stock up on tampons, maxi pads, stock up on diapers for trade and barter. And I'm having a hard time wrapping my brain around that. You're going to stock up on food. Why, if you want to stock up on something to barter and trade, why not stock up on something that you're probably going to use? Now, you may be using diapers. I don't know. But if you're not, why not have extra food and extra items like that? You don't know if you're going to need it to barter, but if you do, I personally think that would be a way to go. No reason to, drop down $500 worth of diapers or just for trade. It doesn't make a lot of sense to me, so I'd be curious what your thoughts are on that. So this is the part 2 that I wanted to address. I wanted to address the ibuprofen gel as well as the feminine products that we need to address for our loved ones, all right, and the other half. Real important stuff. Coming up, wanted to let you guys know we're going to be going down the road of mosquitoes. Why do mosquito bites itch? What to do with mosquito bites? How dangerous they are. We're going to be addressing scorpions coming up. All right. Hey, keep your eyes on the rise and your face to the wind. Stay safe.